Alright guys, Wednesday vlog. Just got off work. Gonna talk about what I actually do today for my, work or career. Gus is just staring at me, so I'm getting a little distracted. Look at Gus here. You can see here he's got kind of like shorter hair. It's because he had to have surgery. I don't know if I've mentioned that in my other videos, but he had an incision down his back there, and it's slowly coming back, his fur, but pretty much his spinal column had to have surgery and open up one of the canals because his nerves were getting pinched, so he wasn't able to use his hind legs. He didn't have any motor functions to him. He wasn't really in pain. He just couldn't. None of his nerves or senses were working in his hind legs. So got surgery done with him, and he's standing, walking, doing great. So that's why he's got a little bit distorted kind of fur or patch of fur that's shorter than the rest. But you're doing good, right, buddy? Yeah. All right. So I should probably be packing or starting to get packed for my week-long, vacation for pickleball. I think it's going to be more of a vacation than China was, because I'm doing something I really, really like. Playing pickleball, going to Florida, having some really, really nice weather. So I'm getting really stoked for that. But we have Thursday to pack. We have Friday to pack. Thursday will be pretty much my main day because I don't have any pickleball. Tonight I have pickleball at 6:30. So about, 5:20 right now? So an hour and 10 minutes. You want up? You want up? Up? No. Alright. Sometimes he likes to sit up on the couch with me. So basically, what I do for a living. It hasn't been always this job, but I am a pharmacy technician. I've been doing this job for a little over 5 years now. I work for a private or a privately owned pharmacy. My boss owns a couple pharmacies. We are actually, where I work, we are contracted with a hospital, so our pharmacy does work within that hospital. He also has a retail location and another kind of off-site location. So he's got 3 different pharmacies. All right, he wants it. Come here, buddy. Look. There you go. All right, let me focus this guy up a bit so you can see Gus as well. All right. So, I've been doing this over 5 years now. Prior to this, I have been doing. I used to work at another hospital, and it wasn't pharmacy related. It was more of putting charts. It was kind of like they call it a health unit coordinator, and you kind of work in the central hub of floor for nursing, and you compile charts, which they have now confirmed or transferred to digital charts or e-charts or whatever you want to call them. But we made paper charts, compiled those, made appointments, kind of like a secretary in a way, but also reading heart monitors. They had surgeries for hearts and stuff, and you would watch the monitors, make sure that there was no irregularities within a patient's heart rate. So did that. Some other features to that job as well. So that's what I kind of went to school for they call it Health Information Services. For my ending part of my school, I went to various colleges, not knowing really what I wanted to do. I thought about going into pharmacy early, but that field is very, very difficult to get into. It was kind of like a booming part when I first started college. It was like a booming spot to get into if you could get into it. But right now it is very, very difficult to get into. Like the applicants, I think, are pretty slim. And then finding a job as a pharmacist are not bad, I guess. But to get into it now is pretty tough. So at the time when I went, it was pretty hot and pretty heavy to get into. So let's see. So it started that, and then I kind of changed fields into like a medical lab tech, which is kind of like a phlebotomist with more lab work as well. Like you kind of draw people's blood and you do like sample like lab testing. So I looked into that. Then I looked into like radiology. I applied for that and didn't get in. I feel like maybe I was overqualified at that time because I had quite a bit of schooling. I have pretty much like a minor in Spanish and English and math, and I think almost even in sociology, and biology, just tons of stuff. Always liked math, always liked science as a kid. But I got into this pharmacy role because of people I know, pretty much. So the saying of, it's not what you know, it's the people you know, or it's who you know, kind of worked out that way as well. But I mean, I took a lot of schooling, knew my science and biology stuff quite a bit. Working hard and like being a trustful, like hardworking, like being, kind of helped me get the job as well. So it's not just who I knew; it's what I did as a kid, as a person growing up, kind of built me into that character. So I got into this job being, a trustworthy person. My boss right now asked my cousin, who I work with, if he knew anyone that was, available. So at the time, I was still working at my at the hospital job. It's a Sanford Hospital, pretty large hospital, and my job at there was currently changing. So they were changing from the like standard medical record charts, like physical charts, into the e-charts, and I wasn't sure if my position was still going to be there when they did this, or how it was going to change or whatnot. So this was my backup plan, and ironically, I got like employee of the month, like right before I put like my 2 weeks in or whatever. But I actually took more than 2 weeks off because at the time they didn't need me like urgently at the pharmacy. So I wanted to leave with good conditions and whatnot and get someone else trained if they needed someone. So I worked the rest of my schedule or whatever until till they didn't need me. So that was pretty good. What was that? What is that? Gus hasn't seen anyone all day, so that's our bonding time, right? Bros. Two bros. So, let's see. So I joined this job, currently liking it. Not sure if I'll do it the rest of my life, but I mean, it pays pretty good. I would say our family, like my parents, me and my sister, are probably like middle class people. Middle class to higher part of the middle class. I don't say we're rich at all. We just, save our money and spend it wisely. We used to own a restaurant, a Chinese restaurant, and so we don't really do a whole lot of cooking anymore because we always ate at the restaurant growing up. So we eat out a lot, and I was actually a very, very picky eater. I know we're getting a little off track, but bear with me. So I was pretty much a picky eater when I was growing up as a kid, and now I've kind of learned to taste like food and enjoy like different kinds of food, and I'm willing to try different things. The main things I don't like are mushrooms, mustard, and I think those are my two main things, actually. I thought there was something else. Well, I don't really like horseradish all that much. Um, there's various tastes that, of different things I don't like, but those are the two main things I really could do without on any of my foods. So, one, I don't like the taste of mustard. That's just disgusting. I can't eat it with burgers or hot dogs. And mushrooms, it might not be the taste that's bad, but knowing that I'm eating like a fungus is just kind of awkward, and it's just kind of gross, I guess. So I know there's probably a lot of good foods with mushrooms, but I just can't stand mushrooms. It's just weird. It's like eating Toad, from Mario, just eating a bunch of those guys. So I don't like that. Let's see. So going along with the food line, I told you I have it connected. My job, or the location I have, they don't have like a cafeteria or anything. So my lunch, I get a free lunch every day when I work there because the food is catered. They have a caterer every month. Sometimes it varies. And so every other Thursday, they have a special caterer, if that makes any sense. So, alright, that was a pickleball phone call, actually. So, like I was saying before, we got 4 different caterers than the original caterer. Next one is Big Rig Barbecue. They serve like different kinds of briskets and like ribs or whatever, and pulled pork. And the next one is honey baked ham, which are like sandwiches, like gourmet sandwiches, are super good. But I will be missing this week, which sucks because I like honey baked ham, but I'll be in Florida, and hopefully I'll be getting like, I don't know, surf and turf, or crab legs, or sushi, or Italian pizza, whatever I want. I'll be paying for it, of course. But this food's free, but it's always good to change it up, and having something different is pretty cool. So we'll get this guy fed. Look at you. So that's what I do for lunch at my workplace. So that's pretty cool that I get free lunch every day. What I wear, this is what I wore to work. It's whatever I want because I change into scrubs. They have scrubs already there, so I don't have to pay for my own. So that's pretty cool too. And then what I do at my job, oh man, it's like more like what I don't do. So for this hospital that I work at, they have some overnight surgeries, which the patients stay overnight, and I fill their meds or whatever the doctor orders, for them to be on while they stay at our hospital. So there's these little trays, and we print out their med list or whatever, and you fill the trays, and then that goes up there. So that's one part. That's just a daily thing. I also count out prescriptions. So at the other pharmacy that my boss owns, they do strictly like retail. They also do compounding stuff as well. He's pretty connected to like all the hospitals and all the other pharmacies because he's been doing this for quite a long time. But at that location, they kind of mainly do retail sales. So retail, pretty much, a person comes in to get the prescription filled, and you just fill the prescription. So we fill some prescriptions at the hospital as well. So like when a patient gets done with their surgery, the doctor writes a prescription on what they take for the next 1 to 2 weeks or next 3 days or whatever, and we fill that, and that's that. So that's prescription filling. Let's see. Oh, there's tons of stuff like unit dosing. Unit dosing, pretty much, you get like a bottle of meds, and we'll just put it into little capsules or little, how to explain this? Little packages, I guess, so that they're individually wrapped, so that they can just scan the barcode, and so it verifies it with the same patient or the right patient with the correct med. And so I do that, and so they can open it up right away and just give it to the patient. Then there's the compounding part, which compounding is pretty much making or mixing various drugs, so that's pretty cool too. I make the antibiotics for each patient, or for a lot of the patients. Some of them are already pre-made that we get from our suppliers or whatever. But a lot of times I will mix different drugs for a certain like cocktail, I guess. So I do that, or I mix like saline, which is like salt water, with a antibiotic, and prior to surgery they will be given a certain antibiotic just to be healthy or whatnot for their surgery, to be ready for that. So I do that. We do a lot of surgeries, various surgeries, whether it's like OI or orthopedic surgery, like a joint, like elbows or shoulders, hips, knees. There's spinal surgeries that are done. There are GI, which are like gastrointestinal surgeries. Anything from like hemorrhoids or dental surgery, nose surgeries, ears. We do pediatrics. Pretty much anything. They're all planned surgeries for the most part. It's not like there's not like an ER emergency room where people just get taken in. Hey, broke my arm. Fix me right now, or my hand got amputated. Nothing like that. They're all pretty much scheduled surgeries for the most part. There are some add-ons, but when they're added on, it's nothing too big or whatever. It's just whatever. But these surgeries are, pretty scheduled, pretty routine. There's a solution I mix a lot, and a lot of doctors now are asking for it a lot more. But those are like knee surgeries or hip surgeries, like a arthroplasty and like a knee arthroplasty. So a lot of those. And so I make a lot of solution. I'm pretty much in the compounding room, or the clean room, if you want to call it. Very sterile room. Like you can wear like a gown, mask. What do you call it? Headgear, not headgear, but drawing a blank. Gloves, booties for your shoes, and then I'm already in my scrubs. Cone mask, facial mask, whatever. It's like a hairnet. It's not a hairnet. It's like but pretty much same thing. So that, and then we have a laminar flow hood. If you want to Google that, it's just pretty much a big hood, sterile working area, blows air out, bad air out, or whatever, and just recycles or whatever. So work under there quite a bit. I probably spend at least 1 to 2, maybe 3 hours under there, making or mixing solutions or whatever. I work 8 hours a day for the most part, unless I work a little bit more for like overtime, whatever. My boss does not like me to get overtime, so usually if I do work extra one day, I'll just leave early another day, or come in later one day. But I am the only technician right now. The one technician that we had before, we've had other technicians, but they just moved on to various other jobs, or were part-time and have gone full-time somewhere else. The one that was working with me before, she wasn't certified. So in this state, you have to be certified and registered. Registered is pretty easy. You just register with the state that, hey, I'm a pharmacy technician. Certified, you have to take an exam and pass. That was just implemented, I think, last year for our state. If you had joined early enough, you could be like grandfathered in and wouldn't have to take the test. But I have to like recertify, every other year or something like that. I can't remember. But pretty much you have to do continuing education credits as well. That's every 2 years. You have to submit them. Sometimes you have to pay for the classes. Sometimes they're free ones. So a lot of them are online, just like online workshops. You kind of read this thing and you answer questions at the end, like 10 to 20 questions at the end. It's not too bad, but it's kind of annoying to do these, but it is what it is. It's part of the job. What else? There's also there's restocking. So there's different departments within this hospital, like anesthesia, OR, the PACU, pre-op, and we call it phase 2. It's like recovery after PACU, and then recovery care, which is the overnight stay that patients stay at. So I restock those units with meds and I check those daily. There's outdates you have to check. Outdates are a pain in the butt, which pretty much is when a drug expires or the expiration date, you have to change it out and dispose of it. So checking for those like every month, because drugs usually will outdate at the end of the month, or if you unit dose them like we do, it's a year after. We have packaging that is good for a year once they are unit dosed, or so if you unit dose them like today, they'll expire in a year, like the same day or whatever, the next year. So it wouldn't expire technically at the end of the month. It would expire, would it stay the 4/19, 2017, and so it expired 4/19/2018. So it wouldn't expire at the end of the month of next year. So a little bit more information than you probably want to know, but whatever. Work 8 hours a day. What else is there to say about it? That's pretty much the main gist of it. The difference between working for a private pharmacy, privately owned pharmacy, compared to like the big company I was working before, are pay raises and benefits are the probably main differences. So benefits, I don't really get a whole lot of benefits of like no dental or we just kind of got into like a 401k kind of program right now. As of 5 years that I've been working, you slowly get benefits of health insurance. So before, like I think when you like work 2.5 to 3 years, you get half of your health insurance paid for, and after 5 years, you get everything paid for. But again, like I said, no dental or none of that for me. So the benefits are kind of smaller, but the pay raises are a lot better for sure. I kind of get really good bonuses, and pay raises are really good. So, all right, my battery ran out, but I kind of lost track of what I was saying because I just fed Gus. Let's see. So right now, I have been overstocking a lot of the units, or trying to, because I will be gone for a week. And so instead of getting like a day off for the whole week as PTO, I am really booking it and overworking, or trying to get everything kind of stocked up for a week when I'm not there. So that's what I'm kind of doing this week, and trying to make it a lot easier for my coworkers, so they don't really have to check stock, that it'll be overstocked, and all they have to do is grab something from the back of the shelf to just put it back into the bin. So that's what I'm currently doing. I'll probably have to make an extra dose of antibiotics as well, because like one day I'll just make a 50 batch or 100 batch of cefazolin. Pretty much what you'll do for that is you'll have this powdered solution. You throw like sterile water into that solution, shake it up till it like dissolves, and inject that solution from that bottle into little IV bags, and those are like little 50 ml IV bags, and I'll do like 50 to 100 of those. That takes anywhere between like an hour to 2 hours, depending on how many I do and if I'm working solo. Usually we could do a 100 batch. Me and another technician could do it within an hour for 100 of them pretty quickly. And that's getting them diapered, which basically puts a protective covering on the IV spot. And labeling them. So without another person, it probably takes like probably 2 hours for me, because one, if I don't have all the supplies with me, I gotta go downstairs get the supplies. You have to alcohol swab all the injection sites of the IV bag prior to that, as well as alcohol swabbing all the cefazolin bottles, and then hooking up that line, drawing out the water, sterile water, and putting it into the bottles. By the time like all those bottles dissolve, the should be good enough where you can just start injecting it. But if I'm working solo, I inject the sterile water into the bottles, let them dissolve. You gotta shake them up, let them sit for a bit. But if you're doing 100 of them, by the time you finish, you start on the first bottle and get the last bottle. Usually they'll be dissolved by then. But since you're working solo, you do that, and then I gotta go to the other room and start swabbing the bags, or getting all the bags unwrapped. And like each of these bags come in like a bigger bag, and then you gotta unwrap those, get them out, and then swab them. So you gotta do 100 of those. So that could be like one day, or I could do that 2 times a week, like whatever, depending on how busy the hospital is. God, this guy. Gus isn't wearing his shirt. I guess you saw that previously, but it's been a while since he hasn't had a shirt on. He's always had a shirt. We try to get his shirt on, but he doesn't like putting the shirt on. He kind of growls and yips at you if you try to put the shirt on him. But once it's on, it's alright. But pretty much what the shirt kind of does, well, one, obviously it kind of hides this, but I don't really mind that. But for the main reason that I thought we put it on was to compress. We wanted something to compress this little hump. It's a seroma. Nothing big. It's just it swells or gets inflamed a bit, just because he moves around, and that's where his incision runs down here. But that's that. So it's kind of gotten bigger. He used to take take meds for the inflammation and to decrease the swelling, but he's off that, so it's kind of got a little bump there. But that's all right. We're doing good. So that's my take on what I do. I know it's a long video, but it could be longer if I went into like super detail of everything I do. But that's the main gist of it. If you guys want it, to know anything else, throw some comments or stuff. That's always helpful. And if you liked it, hit that like button. And don't forget to subscribe if you haven't. And peace out.